On this occasion, I will discuss about health and safety in the workplace in the Secretarial Practice course. Professionally, introduce my name Meri Anggraini with MPN 2341-1181 from Management 23A class, Faculty of Economics and Business, Universitas Demokrat Indonesia.
Understanding health and safety in the workplace. Occupational health and safety, also known as OS, Occupational Safety and Health, or HSE, Health, Safety, and Environment, is an effort to ensure a safe and healthy working environment for all employees. The goal is to reduce the risk of accidents and occupational diseases, and improve employee productivity and well-being. Definition of occupational health. Occupational health is a discipline that focuses on the maintenance and improvement of the physical, mental, and social health of workers, as well as the prevention and control of workplace hazards. Definition of occupational safety. Occupational safety, often referred to as OS, Occupational Safety and Health, is an effort to ensure a safe and healthy working environment for all workers, so as to prevent occupational accidents and occupational diseases. It involves various activities to identify, evaluate and control hazards in the workplace, as well as provide protection to workers from risks associated with their work. Objectives of OS, Occupational Safety and Health. 1. Prevent work accidents. OS aims to reduce the risk of occupational accidents and occupational diseases. 2. Protect workers' health. OS ensures that workers have good health conditions and are protected from hazards in the workplace. 3. Increase productivity. A safe and healthy work environment will improve worker productivity and performance. 4. Ensure safe use of production resources. OS ensures that equipment, machinery and raw materials are used properly and do not pose a hazard. 5. Improving worker well-being. OS contributes to the overall improvement of workers' well-being, whether physical, mental or social. 6. Protecting the environment. OS also plays a role in protecting the environment from the negative impacts of work activities. 7. Avoiding costs incurred due to work injuries or accidents. By preventing accidents and illnesses, OS helps reduce costs associated with medical treatment, compensation, and lost productivity. Basic OS Principles. 1. Safety is a moral and legal responsibility. Every individual, including management and workers, has a responsibility to ensure occupational safety and health. 2. OS is a culture, not just a program. OS implementation should be an integral part of the company culture and not just a temporary program. 3. Prevention is better than treatment. OS efforts should be focused on preventing accidents and occupational diseases, not just on responding after an incident. 4. Protection of workers' rights. O's implementation protects workers' rights to work in safe and healthy conditions, and to be compensated in the event of a workplace accident. 5. Safety is everyone's right. Every worker has the right to a safe and healthy working environment. 6. Training and education. Workers need to be trained and educated on workplace hazards and how to address them. 7. Risk control. Risk identification and control is an important step in implementing O's. 8. Continuous evaluation and improvement. O's systems should be regularly evaluated and refined to ensure their effectiveness. 9. Effective communication. Information on O's must be communicated clearly and effectively to all workers. 10. Participation of all parties. O's implementation requires active participation from all parties, including management, workers and contractors. Importance of work-related health and safety. 1. Identify work-related illnesses and injuries. 2. A safe workplace encourages employees to work more effectively. 3. Reduce treatment, compensation and absenteeism costs. 4. Analyze the legal implications of employee work-related stress. 5. Enhance a company's reputation, both to investors and the general public. Common risks in the workplace. 1. Safety hazards such as slips, trips and falls are the most common risks in many workplaces. 2. Physical or environmental hazards, such as exposure to noise, vibration, radiation and extreme pressure can cause health problems. 3. Biological hazards, such as exposure to bacteria, viruses, fungi and spores can cause infectious diseases, especially for workers in the healthcare sector or laboratories. 4. Psychosocial hazards, such as workplace stress, violence, harassment or exclusion can lead to mental health problems, such as anxiety or depression. Examples of real risks. 1. Traffic accidents. If workers travel to work, the risk of traffic accidents is a risk that must be considered. 2. Exposure to sharp objects or machinery. Workers who work with sharp tools or machinery are potentially exposed to injuries due to careless use. 3. Inhalation of toxic gases. Workers who work in environments with toxic chemicals have the potential to inhale the toxic gases. 4. Muscle injury. Workers who perform repetitive motions or lift heavy weights have the potential for muscle injury. Health and safety responsibilities. A. Employers. 1. Provide safety training. 2. Provide personal protective equipment, PPE. 3. Conduct regular risk assessments. 4. Provide first aid facilities. B. Employees. 1. Follow safety training and instructions. 2. Use PPE properly. 3. Report hazardous conditions to superiors. 4. Abstain from actions that endanger themselves and others. Efforts to improve health and safety. 1. Routine training. Education on evacuation procedures, PPE usage, and first aid. 2. Audits and inspections. Regular checks of equipment and work environment. 3. Standard operating procedure, SOP, implementation. Standardized safe work guidelines. 4. Employee health program. Medical consultation, periodic health checks, stress management. 5. Safety culture. Encouraging active participation of all parties in maintaining safety. Examples of personal protective equipment, PPE. 1. Safety helmet. 2. Gloves. 3. Mask or respirator. 4. Protective eyewear. 5. Safety shoes. 6. Reflective vest. Regulations and standards. 1. Indonesia. Law No. 1 Year 1970 on Occupational Safety. Minister of Manpower Regulation. 2. International. ISO 45001 Occupational Safety and Health Management System. Standard from ILO, International Labor Organization. Technological innovation in OS. 1. IoT, Internet of Things. Supports real-time monitoring for work safety through environmental sensors, temperature, humidity, air quality, noise, wearable devices to monitor workers' physical conditions, heart rate, fatigue, as well as location tracking systems in risky areas such as mines or construction projects. 2. AI, artificial intelligence, can be used to analyze OS data to identify accident trends, risk areas, and contributing factors. Based on historical data and environmental conditions, AI can also predict potential accidents and provide early warning systems to prevent workplace hazards. 3. Augmented reality and virtual reality can be utilized in OS and ergonomics training by providing realistic interactive simulations, allowing workers to practice dealing with hazardous situations and learn safe work techniques, such as how to lift weights correctly, without any real risk. 4. Drones can be used to inspect hazardous or hard-to-reach areas, such as construction sites or mines, and create 3D maps of work areas to support safety planning and risk management more effectively. 5. A strong safety culture can be supported by technology through more effective OS training and education, and increased worker engagement through mobile apps or digital platforms. Conclusion. Creating a healthy and safe workplace is a shared responsibility between management and employees. Health and safety is not just about complying with the law, but also a long-term investment in the sustainability of the business and the well-being of the workforce.
Okay, thanks for watching and hopefully this video is useful. See you in your next video.